Elevations in tyrosine are an expected finding in patients who are receiving nitisinone. It can be a bit of a surprise because the typical tyrosine levels in plasma amino acids are like 60 to 90. And when patients are on nitisinone, those levels can be 800 to 900. So it is really a tenfold increase, at least, in tyrosine levels. However, those elevations are typically very well tolerated. Most individuals really don't notice anything from those elevations. In a few percent of the patients, however, the elevations of tyrosine can cause crystals to form in the cornea of the eye, and that's called keratopathy. It's important to know that keratopathy is reversible if the medication is discontinued for a short period of time. And so for patients that develop those keratopathies, we really want to keep an eye on plasma tyrosine levels and potentially, if they're developing the keratopathy, implement a diet that is tyrosine and phenylalanine restricted in an attempt to keep the plasma tyrosine levels a little bit lower, closer to the 500 micromolar range.
Important safety information. Indications. Harlequin is indicated for the reduction of urine homogentic acid, HGA, in adult patients with alkaptonuria, AKU. Important safety information. Do not prescribe Harlequin to patients allergic to nitisinone or any other contained ingredients. Warnings and precautions. Ocular symptoms and hyperkeratotic plaques due to elevated plasma tyrosine level. Ocular signs and symptoms including keratitis, corneal opacities, corneal irritation, corneal ulcers, conjunctivitis, eye pain, and photophobia have been reported in patients. Perform slit lamp examination prior to treatment and regularly thereafter. Re-examine patients if symptoms develop or tyrosine levels are greater than 500 micromoles per liter. Assess plasma tyrosine levels in patients with an abrupt change in neurological status. Perform a clinical laboratory assessment, including plasma tyrosine levels, in patients with an abrupt change in neurological status. Leukopenia and severe thrombocytopenia. In clinical trials, patients with hereditary tyrosinemia type 1, HT1, treated with another oral formulation of nitisinone and dietary restriction, developed reversible leukopenia, thrombocytopenia, or both. No patients developed infections or bleeding as a result of the episodes of leukopenia and thrombocytopenia. Monitor platelet and white blood cell counts during Harlequin therapy. Adverse reactions. The most common adverse reactions, greater than or equal to 1%, reported in patients with AKU taking nitisinone in clinical trials are elevated tyrosine levels, thrombocytopenia, and keratitis. Drug interactions. Nitisinone is a moderate CYP2C9 inhibitor and a weak CYP2E1 inducer. Potential clinical impact of Harlequin administration with CYP2C9 substrates. Reduce the dosage of the co-administered drugs metabolized by CYP2C9 by half. Additional dosage adjustments may be needed. Nitisinone is an inhibitor of OAT1/OAT3. Potential clinical impact of administration with OAT1/OAT3 substrates. Patients should be monitored for potential adverse reactions. Use in specific populations. Pregnancy. Limited available data with nitisinone use in pregnant women are not sufficient to determine a drug-associated risk of adverse developmental outcomes. The background risk of major birth defects and miscarriage for the indicated population is unknown. All pregnancies have a background risk of birth defect, loss, or other adverse outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered against the mother's clinical need for Harlequin, along with potential adverse effects on the breastfed infant from Harlequin or from the underlying maternal condition. Pediatric use. The safety and effectiveness of Harlequin have not been established in pediatric patients with AKU. Geriatric use. Insufficient data from clinical studies of Harlequin to determine if patients greater than or equal to 65 years of age respond differently. Elderly patients should be cautious reflecting any decreased hepatic, renal, or cardiac function, and of concomitant disease or other drug therapy. For more detailed information, please refer to the full prescribing information at harlequin.com/pi. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-855-831-5413 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.